Hello, I am Dr. Manjiri Valsankar, Director, Bhide Hospital Test Tube Baby Center, Manjiri Pune. Today, let us talk about the types of injections in IVF technology. Now, we know our basics that whenever a couple cannot naturally conceive, we assist them with the help of assisted reproduction technologies like IUI, IVF, ICSI, etc. Now, during the process of this test tube baby, as we have discussed previously, the patient needs to come on the second or the third day for her reproductive capacity or her ovarian reserve assessment. Now, if her assessment is poor, then we have to give her certain artificial injections because of which her eggs or her oocytes will increase in quantity and quality over the next 10 to 12 days. Which means, to simplify, the patient needs to take certain artificial injections of hormones from the second day of her period for the next 10 to 12 days. And effectively, the nature or the quality of her eggs which are retrieved during the test tube baby procedure are directly proportional to the potency of the injections which are given to her. So, if we are giving injections, ideally we go in for the best possible injections which are available. Now, injections are of various hormones. When test tube baby technology was started way back in 1990, that time the injections were not that advanced and they were in fact made by filtration and certain very crude procedures from the urine of the menopausal women, and these hormones were separated, filled in syringes and administered to the patient. Hence, it resulted in a lot of side effects that time. In the next 2 to 3 decades as of now, there has been a tremendous advance in the injection technologies, and now we have painless test tube baby injections which the patient can take for 10 to 12 days completely by herself or can be administered by the hospital staff under monitored circumstances. These injections need to be taken at the same time. They are absolutely painless. In fact, I can show you an injection. The injection looks like this, and the dose can be dialed on the pen, and these are pens which are having a very fine needle and which can just be administered by the patient herself, and these are absolutely advanced and painless injections which are available. Now, whenever the injections are of the best quality, it has been noted that the eggs which we retrieve are of a very high quality and thus resulting in an excellent quality of the embryo as well. We do have certain Indian injections which are as potent as these injections from overseas, but then they are not devoid of side effects. So sometimes we have seen with the Indian injection certain side effects like pain, swelling, redness at the site of injection. Sometimes the patient has that aching sensation throughout the day after the injection is administered, and so on and so forth. So if you are undergoing an IVF procedure, frankly, talk to your doctor and you can go in for the best possible injection technology which will be painless, which will be much more effective, and which will give you a better quality embryo as compared to the counterparts. Thank you.